As part of efforts to ending the scourge of malaria in Nigeria, billionaire businessman and former lawmaker at the lower chamber of the National Assembly, Prince Nwoko, has suggested the lockdown of the 36 states and the FCT for fumigation to take place. Nwoko, while addressing newsmen in Abuja at a malaria awareness walk, explained that fumigation exercise, which will tackle breeding of mosquitos, would also provide jobs for over 500,000 youths.
Fumigation will, on its own, create nothing less than 500,000 jobs. But we're not talking about the kind of fumigation that you will do in various homes now, where you fumigate your homes today, then the next day, all the mosquitoes will come back again. No, we are talking about holistic fumigation from one end of Nigeria to the other. This means that there will be a lockdown. As I said earlier, there will be a total lockdown for a period of time, maybe a day or 2 days, because there will be area fumigation, there will be ground fumigation, there will be sea fumigation. We already have two companies that are ready and waiting to do this. They have what it takes.
Nwoko, who did not give an estimate of the entire cost of the exercise, said although the cost may be enormous, but it does not outweigh the cost of the COVID-19, where the federal government is paying 500 billion naira. He opined that having a recycling plant in each of the 774 local government areas to gather waste that causes malaria would help the elimination of the disease, just as he noted that the proposed fumigation would be environmentally friendly. While the federal government puts the estimated fund needed to tackle malaria at 1.89 trillion naira and about 352 billion naira required for 2021 program implementation, and has appealed to the organized private sector for support, the government says it is working to establish a malarial council to drive domestic funding for elimination of the disease.
So the cost is enormous, but it is nothing like the cost of the COVID vaccine that we read that federal government is paying 500 billion naira for COVID vaccines. Nothing like that. But this is something so important for all of us. You know, we all suffer from malaria. I'm sure that out of all the people that turned out today, maybe 1%, 2% had COVID, isn't it?
Yeah.
But malaria, virtually 99% of everybody here has had malaria, isn't it?
Yeah, sure.
So malaria is our problem and we must focus on it.
Malaria continues to be a leading cause of death in Nigeria, and according to the World Health Organization, over 60% of hospital visits in Nigeria is caused by malaria, 20% of under-5 mortality, 11% of maternal mortality. Perhaps, with this bill submitted to the National Assembly by Nwoko, it is hoped that in the next 3 months, it would have received first reading in the Parliament to move Nigeria away from the norm of selective efforts. Oluwatobianiton reporting for Viable TV.